Welcome to ASHP TV Conversations in the studio. I'm Dwayne Ballin. Joining me today, Dr. Todd Karpinsky, Board of Directors. Welcome, sir.
Thank you.
The opioid epidemic. We hear generally so much about it in all sectors of our society. But how bad is it?
Dwayne, it's pretty bad. As you have heard from our politicians out there, there's been so much coverage in the news. I mean, I think it affects every local community, news stories constantly. There's some data out there that 19 billion pills of opioids are dispensed every year.
With the B, billion.
In 2015, yes, which is enough for every man, woman, and child in this country to have 32 opioid pills a year. That, to me, is staggering.
Where do the health system pharmacists and ASHP members play into this?
Yeah, you know, this is really a multidisciplinary problem in healthcare. I mean, it starts at the board of director level at hospitals. We need to put the highest level folks in tune with the issue so that it does get the highest level of priority. And then it filters down to the physicians, the nurses, the pharmacists. You know, pharmacists every day have a role in this. They're the ones that are dispensing these medications in the retail settings. We're the ones in the health systems with our patients every day. We need to be educating patients on how do we get appropriate pain control, knowing that a pain of none will not happen when you have a surgery or you have to enter a healthcare facility, and really working with physicians and nurses around different pain modalities that don't and always have to involve opioids.
You mentioned pain, and as someone who's been in pain before, there are expectations when we walk in to an expert. We think pain should go away. That's not really what this should be about, right?
Absolutely, and in other countries we see that. They walk in with the expectation that there will be pain. We're going to try to do everything we can to control it and make you comfortable. But if you do have a surgical procedure, or if you go to the dentist to get a root canal, there's going to be some pain involved. And in our country, we have to know that that's okay. We're going to control it with as best that we can. But that, you know, opioids won't always be the answer to get to a pain of zero, a pain score of zero.
Mm-hmm. So then, if we look at it, the education, the continuum is the practitioners, but also for someone like me, a patient. Then, are we at a point? Has it ebbed? Has it peaked? Where do you think this is?
Yeah, I think we're at a point where, you know, pain control was a major issue and concern about 15 years ago in healthcare, and we've done all we can to help patients control their pain and be comfortable. But I think the flow, or the pendulum has swung the other way to now, where there will be some pain. We can't completely eliminate it with the use of opioids, which could, as you know, be potentially addictive and a whole different problem if you continue with them. So let's keep patients comfortable and educate them on different other pain modalities that are available to us. And as pharmacists and the medication experts, we're the ones that can help the physicians determine what that course will be.
So finally, for ASHP members and other practitioners in health systems, what is priority one, mission critical, you think?
Yeah, get educated. We have several programs at the mid-year meeting this year on the opioid epidemic. Really, truly dig into this. Work with the physicians, nurses, and administrators at your organizations. This is a major problem, and it will continue to spiral out of control until we can get a handle on it.
We'll look for ASHP's leadership on this very important issue. Dr. Todd Karpinsky, thank you, sir.
Thank you, Dwayne.
For more on this, you can log on to ashptv.com.